Question 1. Which task can the RN safely delegate to a licensed practical nurse, LPN? A. Developing a care plan. B. Performing an initial assessment. C. Administering oral medications. D. Teaching a patient about insulin administration. Answer: C. Administering oral medications. Question 2. A nurse enters a room and finds a patient with dementia climbing over bed rails. What is the priority action? A. Restrain the patient. B. Lower the bed and stay with the patient. C. Call the provider. D. Turn off the call light. Answer: B. Lower the bed and stay with the patient. Question 3. A client receiving 4 potassium reports burning at the site. What is the nurse's first action? A. Stop the infusion and assess the site. B. Decrease the rate. C. Apply warm compresses. D. Instruct the client to elevate the arm. Answer: A. Stop the infusion and assess the site. Question 4. Which client condition requires immediate action by the nurse? A. Post-op client with pain score of 8 out of 10. B. Diabetic with glucose of 210 milligrams per deciliter. C. Asthmatic client with wheezing and use of accessory muscles. D. Client refusing medication. Answer: C. Asthmatic client with wheezing and use of accessory muscles. Question 5. What is the safest method to identify a patient before administering medication? A. Ask the patient their name. B. Check the room number. C. Verify with 2 identifiers. D. Check the patient's chart. Answer: C. Verify with 2 identifiers. Question 6. Which task is inappropriate to delegate to a UAP? A. Taking vital signs. B. Assisting with ambulation. C. Feeding a stroke patient with dysphagia. D. Collecting a urine specimen. Answer: C. Feeding a stroke patient with dysphagia. Question 7. A post-surgical client reports new calf pain and swelling. What should the nurse do first? A. Massage the calf gently. B. Apply a heating pad. C. Notify the provider immediately. D. Document the finding. Answer: C. Notify the provider immediately. Question 8. A nurse discovers a medication error. What is the nurse's first priority? A. Notify the charge nurse. B. Assess the client for adverse effects. C. Complete an incident report. D. Document the error in the chart. Answer: B. Assess the client for adverse effects. Question 9. What is the best approach to prevent wrong site surgery? A. Ask the surgical assistant to confirm. B. Mark the surgical site with the patient involved. C. Rely on the provider's notes. D. Double-check with a circulating nurse. Answer: B. Mark the surgical site with the patient involved. Question 10. Which client should the nurse assess first? A. A client who is disoriented and wandering. B. A client who needs a dressing change. C. A client waiting for pain medication. D. A client who is requesting water. Answer: A. A client who is disoriented and wandering. Question 11. What is the most effective way to prevent central line-associated bloodstream infections? A. Use clean gloves when handling the catheter. B. Flush the line every 8 hours. C. Maintain strict sterile technique during dressing changes. D. Change the catheter daily. Answer: C. Maintain strict sterile technique during dressing changes. Question 12. Which action contributes to reducing medication administration errors? A. Administering medications quickly. B. Relying on memory for medication schedules. C. Following the 5 rights of medication administration. D. Asking a colleague for clarification. Answer: C. following the 5 rights of medication administration. Question 13. A nurse smells alcohol on a colleague's breath during a shift. What is the appropriate response? A. Ignore and monitor the situation. B. Confront the colleague later. C. Report the behavior to a supervisor immediately. D. Ask another coworker to intervene. Answer: C. Report the behavior to a supervisor immediately. Question 14. What instruction should a nurse give a UAP assisting a client with a new leg cast? A. Encourage the client to walk frequently. B. Keep the leg elevated above the heart. C. Cover the cast with a blanket. D. Massage the toes to improve circulation. Answer: B. Keep the leg elevated above the heart. Question 15. A nurse administers the wrong dose of insulin. The patient becomes hypoglycemic. What should the nurse do first? A. Complete an incident report. B. Notify the physician. C. Check blood glucose and treat hypoglycemia. D. Inform the charge nurse. Answer: C. Check blood glucose and treat hypoglycemia. Question 16. During a fire alarm, which patient is evacuated first? A. Ambulatory patient in physical therapy. B. Patient on bed rest near the exit. C. Ventilated patient in ICU. D. Stable patient with a walker. Answer: B. Patient on bed rest near the exit. Question 17. What is a critical nursing responsibility during the handoff report? A. Review physician orders. B. Update the care plan. C. Ensure accurate, complete communication. D. Count narcotics. Answer: C. Ensure accurate, complete communication. Question 18. A client with contact precautions requests to ambulate in the hallway. What is the appropriate response? A. Allow with no restrictions. B. Inform the client it's not allowed. C. Permit with a clean gown and proper hand hygiene. D. Send a family member to walk with them. Answer: C. Permit with a clean gown and proper hand hygiene. Question 19. A nurse finds a client unresponsive. What is the first action? A. Call a code. B. Begin CPR. C. Check for responsiveness and pulse. D. Get the crash cart. Answer: C. Check for responsiveness and pulse. Question 20. What action promotes safety when using a gait belt? A. Place the belt under the client's arms. B. Secure the belt loosely. C. Apply the belt at the waist over clothing. D. Use the belt only for immobile clients. Answer: C. Apply the belt at the waist over clothing. Question 21. Which situation requires the nurse to file an incident report? A. A client refuses to take medication. B. A nurse gives a medication 1 hour late. C. A patient receives a medication intended for another patient. D. A patient complains about hospital food. Answer: C. A patient receives a medication intended for another patient. Question 22. What is the best action to prevent falls in a confused elderly patient? A. Raise all side rails. B. Apply wrist restraints. C. Place the bed in a low position with a call light within reach. D. Encourage ambulation without assistance. Answer: C. Place the bed in a low position with a call light within reach. Question 23. A new nurse is about to administer a high alert medication. What should the preceptor emphasize? A. Double-check dosage with another nurse. B. Ask the pharmacist to administer it. C. Use a higher dose for faster effect. D. Skip the verification process if rushed. Answer: A. Double-check dosage with another nurse. Question 24. Which patient should be seen first after change of shift? A. A client who needs a Foley catheter change. B. A client complaining of chest pain. C. A post-op client who needs to ambulate. D. A client scheduled for discharge teaching. Answer. B. A client complaining of chest pain. Question 25. A nurse is delegating care to a UAP. Which task is appropriate? A. Inserting a Foley catheter. B. Performing a sterile dressing change. C. Assisting a stable client with a bed bath. D. Administering subcutaneous insulin. Answer. C. Assisting a stable client with a bed bath. Question 26. A confused patient is pulling at the 4-line. What is the safest intervention? A. Apply physical restraints immediately. B. Ask a family member to stay at the bedside. C. Re-educate the patient and use mitt restraints if necessary. D. Discontinue the 4. Answer. C. Re-educate the patient and use mitt restraints if necessary. Question 27. What is the priority action when a medication label is unreadable? A. Guess based on the container shape. B. Administer a smaller dose. C. Discard and obtain a new, clearly labeled vial. D. Ask another nurse to verify it. Answer. C. Discard and obtain a new, clearly labeled vial. Question 28. A nurse receives a verbal order for a narcotic. What is the correct action? A. Administer immediately and document later. B. Write it down and administer without verification. C. Read back the order to confirm. D. Refuse the order. Answer. C. Read back the order to confirm. Question 29. A nurse notices a colleague documenting care not provided. What is the appropriate response? A. Ignore it. B. Discuss it with the colleague in private. C. Report the incident to the supervisor. D. Document the care for the colleague. Answer. C. Report the incident to the supervisor. Question 30. What is the best indicator of a patient's risk for aspiration? A. Age over 70. B. History of GERD. C. Impaired swallowing ability. D. Use of thickened liquids. Answer. C. Impaired swallowing ability. Question 31. Which intervention is essential when transporting a patient with oxygen? A. Increase oxygen flow rate for transport. B. Ensure portable tank is full and secure. C. Disconnect and reconnect at destination. D. Use a wheelchair only. Answer. B. Ensure portable tank is full and secure. Question 32. A nurse hears an alarm from an infusion pump. What is the correct action? A. Ignore it if the patient looks fine. B. Immediately silence the alarm. C. Assess the patient and infusion site. D. Turn off the pump and call pharmacy. Answer. C. Assess the patient and infusion site. Question 33. A client reports that their call light is often ignored. What should the nurse do first? A. Apologize and inform the manager. B. Place the call light closer. C. Notify the charge nurse and investigate the issue. D. Tell the client to be patient. Answer. C. Notify the charge nurse and investigate the issue. Question 34. Which observation requires immediate follow-up? A. UAP assists patient with oral care. B. LPN administers an enema. C. UAP applies heat pack without supervision. D. LPN documents INO for the shift. Answer. C. UAP applies heat pack without supervision. Question 35. During a shift, a nurse becomes extremely fatigued. What is the safest course of action? A. Push through to complete the shift. B. Skip breaks to get done faster. C. Notify the charge nurse and request assistance. D. Take extra caffeine. Answer. C. Notify the charge nurse and request assistance. Question 36. Which action helps reduce hospital-acquired pressure injuries? A. Turning patients every 4 hours. B. Applying lotion once daily. C. Repositioning patients every 2 hours. D. Encouraging fluid restriction. Answer: C. Repositioning patients every 2 hours. Question 37. What is a nurse's responsibility when informed of a new allergy? A. Administer the medication if no reaction is visible. B. Ignore it unless the provider confirms. C. Immediately update the allergy status in the chart. D. Wait to report until shift end. Answer: C. Immediately update the allergy status in the chart. Question 38. A patient refuses a treatment. What is the appropriate response? A. Administer it anyway. B. Notify the provider and document the refusal. C. Persuade the patient until they accept. D. Ask a family member to decide. Answer: B. Notify the provider and document the refusal. Question 39. Which is the most effective way to prevent patient identification errors? A. Ask the roommate to verify identity. B. Use patient room number. C. Use name and date of birth before every procedure. D. Check ID once per shift. Answer: C. Use name and date of birth before every procedure. Question 40. A patient with a history of falls needs to use the restroom. What should the nurse do? A. Tell the patient to go quickly. B. Provide a walker and let them go alone. C. Assist the patient personally to the restroom. D. Instruct the UAP to check on them later. Answer: C. Assist the patient personally to the restroom. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.